Hi everyone, I'm Chae, naturopath and owner of the Wellness Emporium. Welcome to Ways to Wellness. Today we have a new topic and we are chatting about dysmenorrhea. So dysmenorrhea, also known as painful periods, it is a very common condition that I treat in clinic and it can be extremely debilitating for women. It has women fearing or wanting to avoid having their period due to this chronic pain that they experience. Basically, pain can begin from the start of the period and usually peaks at 24 hours into the period and decreases after 48 hours, which is what we often see. It is common during adolescence and it actually tends to decrease as we get older and also also after pregnancy. So there's two different types of dysmenorrhea. We have primary dysmenorrhea. It is pain that is not associated with an underlying pathology. Then we have secondary dysmenorrhea, which refers to pelvic pain related to an underlying pathology, such as endometriosis. So the cause and risk factors, let's start with primary dysmenorrhea. So often the primary cause to primary dysmenorrhea is inflammation. Basically the contractions and the pain you'll feel is due to an increased secretion of prostaglandins. These are compounds that have a hormone-like effect and plays a role in a number of functions in the body, including the contraction and relaxation of smooth muscles. So if they are increased, that is going to cause that contraction and also lead to inflammation and pain. Estrogen also stimulates the excessive production of prostaglandins as well. So estrogen excess equals inflammation due to the stimulation of those prostaglandins. The other causes or risk factors involved in primary dysmenorrhea is stress and anxiety. When it comes to secondary dysmenorrhea, it is caused by an underlying pathology. So endometriosis is a common cause. A narrow opening of the cervix, so actually the abnormal anatomy of the cervix can cause this painful dysmenorrhea, which is why we always suggest getting further investigation by a specialist. Other things are endometrial polyps, fibroids, uterine and pelvic infections are also a common cause. PID, so pelvic inflammatory disease. IUDs can also cause that pain too. Abdominal surgery, STIs, STDs, and also obviously linking back to gut health. So that's SIBO or dysbiosis. Because if you've listened to my previous post, that gut hormone link is very prominent. So common signs and symptoms. Obviously, we are talking about pain. Painful periods is the most common sign and symptom of dysmenorrhea. It's often how you can experience pelvic pain, but also shooting pain down the legs as well, and also the back kidney area too. That can be dull or dragging or like a radiating pain. Alongside that can be headaches and migraines, nausea, and even vomiting. I have many clients that I see that they get to that pain that they need to actually vomit. That's how painful it can be. You may also have like IBS type symptoms, premenstrual, so that could be like constipation, diarrhea, so there's changes in bowel motions, as well as tender breasts, swollen abdomen, those types of signs as well. Next week, so that's it for today, because next week we are going to delve into diet and lifestyle recommendations for dysmenorrhea, and join us in the third week for natural treatments. See you then.